Good morning everyone present here. We are going to discuss about the topic today gingival and periodontal disease in children. In the normal terminology, when you see about the periodontium, it refers to a specialized tissue that both surrounds and support the teeth and maintaining them into the maxillary and mandibular bone. Now coming to the normal periodontium. What is normal periodontium? Normal periodontium, when you see, it is bulky and rounded in appearance. It is skull formation, usually will not occur. Interdental saddle usually areas are there. Keratinized surface is seen. Lower prevalence for the periodontal disease is seen and no stippling is seen. You can see clearly into this picture the margins of the gingiva are flaccid. Attached gingiva is less keratinized and increased vascularity, hence the color is pink. The gingival crevice is 1 mm below the bulge of the tooth. When we see about the permanent gingiva color is color pink in color. Gingival margins are 0.5 to 2 mm coronal to CEJ. More keratinized and stippling is present. The diseased gingiva, when you see the diseased gingiva, the color is reddish in color. The contour is rounded margins. Consistency is leathery and size is increased because of the edematous tissues. Now when we see about the surface structure is loss of stippling is seen. The position and the bleeding is present. Position is usually decreased in the position. Now when we see about the picture, you can see here the marginal gingiva are inflamed. Coming to the modifying factors which causes the gingival disease to happen. These are like mouth breathing, hormonal changes, eruption diseases and systemic diseases and syndrome. Now let us see what exactly mouth breathing. The people who are mouth breathers will have a small kind of a marginal gingivitis which usually will be rectified or treated if it is in the early stages. Hormonal changes also causes gingival to bleed. Eruption gingivitis is something like whenever there is a hormonal imbalance. Systemic diseases and syndromes also causes the gingival issues. Now histopathology, the inflammatory response in children is different from that of the adult. That is, few B lymphocytes and plasma cells are present in case of the children. The response is dominated by T lymphocytes. The children are rarely progress to the periodontal diseases because they have a good immunological responses. Now let us see about the classification of the gingival diseases. Classification of gingival diseases causes acute and chronic gingival diseases. Eruption gingivitis, plaque-induced gingivitis, allergic gingivitis is also one of the common cause of the gingival region which is seen in the children. The acute gingival regions we have herpes simplex virus infection, recurrent aphthous ulcer infection, ANAG, acute candidiasis, acute bacterial infection. Now when we see about the chronic gingival diseases are the chronic non-specific gingival diseases. Chronic diseases are modified by the systemic factors which are like endocrinal diseases, gastric origin. If you have a GI disturbances, then also gingival diseases are seen. And now when we have a drug-induced gingival diseases, the ascorbic acid deficiency gingival diseases. Next, we have a hereditary gingival fibromatosis, acute pericornitis also one of the reason for this gingival disease to occur. Now let us see about the eruption gingivitis. Eruption gingivitis is seen in children which is like usually 6 to 7 years of age, where the permanent teeth begin to erupt. You can see here permanent teeth is erupting, and here you can see the canine is erupting, and where you can see the inflammatory ear. You can see here the central incisor or the lateral incisors is erupting, where you can see the gingival inflammation, and usually it will be correct by itself if the oral hygiene is being taken care properly. Now plaque-induced gingival disease, as you all know, plaque and calculus is the one which causes the gingival disease to occur. In a normal terminology, you can see the plaque is the only form of a thing which will cause the gingival disease to occur. Gingivitis is prevalence in all kind of a dental population, which is called as a gingival diseases proper. Acute gingival diseases are treatment for herpetic gingivitis stomatitis. Since it is like a viral infection, definitely antiviral. At the same time, the care towards the particular thing has to be taken care, so that the droplet infection should not cross from one person to the another one. At the same time, oral hygiene measures has to be taken care properly. In case of the fever or discomfort, the child has to be on anti-inflammatory and analgesic therapies. Next, coming to the recurrent aphthous ulcers, you can see here the small ulceration onto the lip or the gingival margin or the mucosal margin. It is also seen as recurrent aphthous stomatitis. It is a painful ulceration onto the unattached mucous membrane that causes in case of the school age children and adults. This is because usually they say it is stress induced gingivitis. So if the reduction of the stress or any kind of nutrition deficiency, then usually it will take care by itself. Now coming to the condition which is called as acute necrotizing ulcerative gingivitis. What exactly it is? It is seen in children 1 to 2 years of age. It is an epidemic like in occurrence. You can see here ulceration and you can see here the necrosis also. The whole gingival margin is necrosed. The margins are necrosed. What is a necrosis? Necrosis is nothing but a inflammation, and in case of the inflammation and the cells are being dead because of the more inflamed reactory agents. Now you can see here the punched out appearance. These are the punched out appearance. Pseudomembranous slough. These are the slough. When you take out that slough, usually it bleeds with the mucogingival margins. Next, oral hygiene usually very poor. The reason for this oral hygiene being poor is since it is an acute lesion, and once you try to brush the area or once you usually try to clean that area, it easily bleeds with a severe painful condition. That is the reason child usually skip the brushing. At the same time, even the caretakers usually skip the brushing. Why? Because they feel that if I brush and the bleeding may aggravate. Now coming to the condition which is like taken care, especially as the inflammation is seen, you are supposed to reduce the inflammatory conditions, which has to be taken care first with the oral hygiene measure. Then later on the analgesics and antibiotic therapy has to be given, and regular recall and subgingival curettage if it is seen with the gingival margins also. This is a treatment for acute necrotizing ulcerative gingivitis. Again, recall revisits are very important. Next condition is called as acute candidiasis. It's also called as a thrush or monoliasis. It is caused by the Candida albicans. It is commonly inhibited in the oral cavity, which is always present. It's not kind of a new to your oral cavity. It is always present in your oral cavity, but may multiply rapidly and cause the pathogenic state when the tissue resistance is low. The clinical feature usually it appears as a fiery, curdy, white appearance, which is usually easy to produce bleeding onto the surfaces. So what will happen? These neonatal candidiasis contracted during the passage through the vagina, erupting clinically during the first or 2 weeks of the life. It is common occurrence. It can be like easily wiped out or taken care of. Then the treatment for this is antifungal or agent, where the nystatin QID has to be applied. For infants and very young children, a suspension of 1 ml of nystatin may be dropped into the mouth for local action 4 times a day. Then clotrimazole suspension, that is 10 mg per ml, 1 to 2 ml is applied to the affected areas 4 times a day, and the antifungal medication has to be started. This is the treatment for it. Now let us see about the chronic gingival diseases. Chronic gingival diseases are puberty gingivitis. In case of puberty gingivitis, it is occurred from 11 to 13 years of age. That decreases slightly, usually after the puberty is gained, and hormonal changes are there. That's the reason usually it will be taken care with the hormonal supply, which is a normal thing, and once the child is growing, then usually it will subside by itself. Now, vitamin C deficiency gingivitis, which is like scorpic gingivitis, this is also associated with vitamin C deficiency, and then differs from the type of gingivitis and related to the poor oral hygiene also. Involvement is limited to the marginal tissue, the papilla. So when we see about this vitamin C deficiency gingivitis, it is usually a supplemental deficiency. So you are supposed to provide a diet which is loaded with the vitamin C supply. So it is usually involved to the marginal gingiva. At the same time, if you take care of the oral hygiene, what will happen? The oral hygiene care can be taken care well. Then usually with a proper supplement, with the fruits which are loaded with the vitamin C, at the same time vitamin C supplements, the Suck C and the Lim C can be given according to the body weight. We can divide the doses and we can supply the medication. At the same time, oral hygiene care is very important. If it is been untreated, you can see here the margins where the supplement of the vitamin C is not given, then definitely overgrowth of gingiva is also seen. But if you take care of these measures, usually the growth will be reduced. Now coming to the drug induced gingivitis. Drug-induced gingivitis is nothing but a phenytoin sodium, cystosporin, nifedipine. These are the drugs usually which causes the gingival disease to occur. So phenytoin sodium is nothing but the anti-conversion drug, which is like 50% of the subjects who are taking a drug, and most severe in case of the teenager who are like in care of the institutions. So usually the children which are like onto the care, that usually will be having the phenytoin sodium deficiency. So that doesn't mean that you are having to reduce the phenytoin doses or something, because it's a life-saving drug which is like given into the children who are on to the epileptic therapies. So the first and foremost thing what you are supposed to do is like you are supposed to first take care of the gingival margins, which is loaded with the plaque or the calculus, and then later on the subgingival curettage has to be done. Oral hygiene practice has to be taken care. Since it is like bulky in nature, usually children will tend to go for aesthetic issues. At the same time, if the bulkiness is so more which is obstructing into the occlusion and all, then easy gingivectomy is also advised. The deficiency of the folic acid may lead to the impaired maturation of the oral epithelium, the gingival enlargement, which is refers to the overproduction of the collagen rather than a decreased and in degradation, rather than a decrease in the degradation, and this may be brought about by the action of the drug on the phenotypically distant group of fibroblasts that have the potential to synthesize the large protein. You can see how badly that it are totally embedded into the gingival margin. Next, coming to the drug which is like phenytoin, or after the phenytoin we have nifedipine. The same, the drug also has kind of these issues onto the gingiva, which is like calcium channel blocker, and the incident of gingival overgrowth to the students or you can say the patients usually taken is 10 to 15%. You can see here the overgrowth is being seen. So for this treatment also you cannot stop the drug, because since it is a life-saving drug, then this kind of a drug has to be taken care regularly. At the same time, under the physician control, you are supposed to do the oral hygiene care and repeated recall and revisits. If there is a recurrence is occurring, then the subgingival curettage or the care to the gingiva and the periodontium has to be evaluated. Now let us see about the condition which is like hereditary gingival fibromatosis. It is like overgrowth of the gingiva because of the genetic origin. So here genetically also some deceased teeth are also seen with this. The treatment is surgical removal of the hypoplastic gingiva to favorable oral and facial appearance. However, the hypoplasia can reoccur within the few months after the surgical procedure and can return to the normal condition within the few years. So this is a treatment for it. Now let us see about the periodontal diseases in children. So usually the risk factor for the periodontal diseases, they are like general factors, microbiology, host defense, genetic factors, ethnicity, modifying factors, systemic. So what is a general factor? General factors is nothing but certain kind of non-oral hygiene care. Microbiology, where the S mutant counts is more, and the count for that particular bacteria are more. So what you are going to take, that microbiology also cost. Host defense factors. So what is the host defense? If your defense mechanism is not good, then you will be having this kind of a disease. Genetic factors also causes. For example, some certain diseases are genetically run into the family. Modifying factors like mouth breathing and all. Systemic diseases, children who are involved with the systemic disease, these are the risk factor for the periodontal disease. So usually periodontal disease is not common in case of the children. But let us see what children will be having if there is a periodontal involvement. We have early onset of periodontitis, which is like divided into or classified into three types. So that is like localized aggressive periodontitis, generalized aggressive periodontitis, pre-pubertal periodontitis. And coming to the systemic disorder which are associated with the periodontitis, which is like leukemia, cystic, cyclic neutropenia, phosphophatasia, then different kind of a syndrome, acrodia, Down syndrome, diabetes mellitus and all. Now when we see about this early onset periodontitis is of two types, aggressive and pre-pubertal. Aggressive is like localized and generalized. Pre-pubertal is generalized and localized. Now let us see about the localized juvenile periodontitis. What is juvenile periodontitis? Which is seen in case of the children. Rapid and severe loss of the alveolar bone. Around more than one permanent tooth is usually the first molar and incisors. The microbes are involved with the AC and that Actinomyces bacillus and the bacterioids and causes the neutrophil deficiencies. The treatment for it is like 2-week course of the doxycycline, which will reduce the production of this population of the antibiotic. Next, surgical removal of the infected clavicular epithelium and debridement of the root surfaces during the surgery. Meticulous scaling and root planing of all the teeth with contaminant irrigation with a probing depth, then saturated inorganic salt solution with 1% of chloromethine. Then addition of the systemic tetracycline for 14 days. Daily application of the paste of sodium bicarbonate and 3% of the H2O2 and inorganic salt irrigation. What it will do? Effervescent because of this H2O2. What will happen? Because whatever remnant are there inside, usually it will be cleansed off. Now coming to the gingival general juvenile periodontitis. It occurs in around the puberty and affects the entire periodontium and marked periodontal inflammation and heavy accumulation of the plaque and is seen. Localized pubertal periodontitis is nothing but associated with that abnormality in the host defense, family history of periodontitis, these kind of systems where you are going to see the disease occurrence not only into the early stage but also if it is not been taken care, the early loss of the teeth also seen. Associated symptoms, as you all know, the The antibiotic therapy is like amoxicillin in children, 250 milligrams liquid 3 times a day for 10 days. Tetracycline is 250 milligrams twice for the 10 days, and care for the wound is very, very important. We also see certain kind of a periodontal abscess which is also in children. So what is that abscess? Abscess is nothing but a periapical abscess, pericorneal abscess, gingival abscess. Periodontitis as a manifestation to the systemic diseases also is being seen, which is like leukemia. Leukemia, as you all know, it's a progressive malignant hematogenic disorder characterized by abnormal proliferation and development of leukocyte and precursor of leukocyte in the blood and bone marrow. Leukemia is classified into the acute and chronic. And when we see about the signs and symptoms, the signs of the inflammatory cells like swollen in gingiva, glassed and spongy tissues, and which are red to deep purple appearance. Gingival involvement has been reportedly initially beginning of the interdental papilla, followed by marginal gingiva. Now the picture you can see here, fever, recurrent fever for 6 months, lymphadenopathy and large number of infiltrating immature leukocytic cells. Another condition which is seen as Down syndrome, which is also seen as very common, like in case of the children we have a very common situation where you come across with the Down syndrome, defective immune response will be seen. Abnormal host response is also seen, where the functional defects in the neutrophil chemotaxis, aggressive form of periodontitis this is a type of where usually will be seen. So whatever is the condition you are supposed to see, make sure that child is comfortable into the situation. At the same time, oral hygiene care has to be given. Regular recall and revisits are advised. Then we have some kind of leukocytic adhesion deficiency syndrome, which is like autosomal recessive diseases. You can see here so much of the bone loss occurrence into it. Then we have other syndrome which is like Papillard-Lefevre syndrome. Some patient with the increased susceptible to the infection. These are the syndrome which usually will cause. So this is the picture where you can see involvement of the diabetes mellitus, the physician care, at the same time the oral hygiene care, at the same time medical, at the dental care has to be done. So this finishes my class, which included the acute and the gingival region, which are chronic in nature, the treatment facilities for it at the same time, and if it is taken care at the earlier stages, it can be taken care well. Thank you. These are like inflammatory response to the plaque is very much. Increased severity and rate of destruction is seen. Attach and bone gingival are usually been across. PMN defects are seen. Increased colonizase, increased cross-link collagen by AGE, delayed healing and repair is also seen. So this is a condition where you will be seeing about this gingival disease. So if the child is suffering with the